वेलकम टू आवर डिजिटल लाइब्रेरी। हेलो फ्रेंड्स, आज का हमारा टॉपिक है क्लिनिकल एनाटॉमी ऑफ कार्डियोवास्कुलर सिस्टम। होप सो यू हैव ऑल सब्सक्राइब्ड आवर चैनल। नाउ इंट्रोडक्शन पार्ट। Cardiovascular system is a complex part of the body that is absolutely critical to maintain its health and longevity. It is also known as the circulatory system or vascular system. The anatomical component of the circulatory system includes the heart and the blood vessels. The heart is the pump that circulates the blood through an estimate of 10 lakh kilometers of blood vessels, and it beats about 1 lakh times a day. The heart pumps more than 14,000 liters of blood in a day, and the study of the normal heart and the disease associated with it is called cardiology. The field includes medical diagnosis and treatment, congenital heart defects, atherosclerosis, coronary artery disease, and heart failures, and etc. Now, starting with the first congenital heart defect, coarctation of the aorta. It is a congenital narrowing of the aorta just opposite to the site of the attachment to the ligamentum arteriosus. This condition is believed to result from an unusual quality of ductus arteriosus muscle tissue in the aortic wall. Later, when the fibrous takes place, the permanent narrowing occurs, and clinically the cardinal sign of the aortic contraction is absence or diminished pulse rate in the femoral arteries of both the lower limb. Due to the narrowing, the flow of the oxygenated blood to the body is reduced. And second, patent ductus arteriosus. In the developing fetus, the ductus arteriosus, also called the ductus botalli, is a blood vessel connecting the pulmonary trunk to the proximal descending aorta. It allows most of the blood from the right ventricle to the bypass the fetus non-functioning lung. After the birth, it normally constricts and later closes and becomes the ligamentum arteriosus. But in some babies, it remains open rather than the closing shortly after the birth. And this condition is known as the patent ductus arteriosus. Now, as a result, the aortic blood flows with a low pressure in the pulmonary trunk, thus increasing the pulmonary trunk blood pressure. Third, septal defect. And a septal defect is an opening in the septum that separates the interior of the heart into the right and left part. This may be either in the between the artery or ventricles. In an arterial septum defect, ASD, the foramen ovale between two arteria fails to closure after the birth, and the ventricular septum is formed only when the membranous part of the septa fuses with the muscular part. And when the two part of the septa is ventricles fail to fuse, the ventricle septum defect occurs. And ventricle septum defects are less frequent than the arterial septum defects. In such cases, oxygenated blood flows directly from the left ventricle to the right ventricle when it mixes with the deoxygenated blood. Now last, tetralogy of the Fallot. This condition is a combination of 4 anatomical abnormalities, including the large ventricular septal defect, stenosis of the pulmonary trunk, and aorta that emerges from both ventricles instead of left ventricle, and an enlarged left ventricle. The defects cause congenital cyanosis and considerably limit the activity. Patients with severe untreated abnormalities die. Once the diagnosis has been made, most children have been successfully treated and this congenital abnormality is responsible for about 99% of the congenital heart diseases, and it can be treated